I'm Sadie Anberg. I'm a physical therapist here at CCM Health, and in the following videos you will find instructions for some of your exercises to have after your recent joint replacement. Please follow the instructions in your guide for how often and how frequently to do your exercises. For ankle pumps, you move your foot up and down through its full range of motion. You can go back and forth to facilitate movement. This helps keep your blood circulating when you're slightly less active post-surgery. For quad sets, you'll focus on tightening the muscle on the front side of your thigh. To do this, give that muscle a good squeeze or pretend like you're straightening your leg. You hold that for a few seconds and then relax. So here it's tight, and here I relax. Make sure to follow your guide for the instructions on how often to do this exercise. For hamstring sets, you want a slight bend in your knee so you can dig their heel into the bed. This will tighten up the muscles on the back side of your thigh. Hold these tight, then relax. Dig your heel into the table or your bed, hold it tight, and then relax. Make sure to follow the instructions in your guide for how often and frequent to do this exercise. For heel slides, you can start with both legs out in front. With the leg of your surgery side, you're going to slide your heel up towards your bottom as far as it will go, and bring it back straight again. Repeat this the number of times indicated in your guide. For straight leg raises, you'll have the leg of your surgery side extended in front and your other leg slightly bent for balance. From here, tighten up the muscle on the front of your thigh, squeeze tight, and keep that leg straight while you lift it about 8 to 10 inches off the table. Bring it back down to the start position and relax. Tighten your thigh muscle again, keep that leg straight, lift it 8 to 10 inches, and bring it back to start. Follow the number of repetitions as indicated in your guide. For the hip abduction exercise, start lying down with both legs extended straight. With your surgical leg, sweep it out to the side like doing a snow angel, out to the range of comfort, about 30 degrees. Bring it back to the middle and repeat as indicated in your guide. For your long arc quad exercise, you'll do this sitting. With your surgical leg, use the muscle on the top of your thigh to tighten up and straighten your leg out as far as you can. Bring your foot back to the ground where you started and repeat. For frontal plane weight shifts, what you'll want to do is have your weight even between both legs, and then you're going to shift your weight from side to side. You want to keep your shoulders over your hips, and so you can glide like a duck on a pond. After joint surgeries, particularly hip or knee replacements, sometimes patients have trouble returning to their normal pivoting motion and using those legs the way they should. To practice this, functional hip rotation exercises can be helpful. For this, you'll begin with your frontal plane weight shift, as previously discussed, shifting your weight side to side. To build on this into the hip rotation, as you shift to one side, you'll then rotate on that planted leg, letting your back heel come up from the ground. Keeping your hands on your hips can help ensure your hips and shoulders stay neutral so you're not twisting through your back. Reverse this motion, shift to the other side, turn to the opposite direction, and let your back heel float up from the ground. Again, reverse this, and as you get into the flow, you can glide back and forth the number of times as indicated in your guide. For stride stance weight shifts, what you'll do is you'll turn to the side, put one foot in front of the other like you're going to take a step, weight on your back leg, one foot forward, and you're going to rock forward like you're taking another step. Your front leg should be straight, and the heel of your back foot should come off the ground. And you can rock back and forth. It doesn't matter which leg you start with, because once you're done practicing, you'll switch feet and go to the other side. For your squat exercise, it's helpful to have a chair in front that you can use for reference so you know whether you're able to keep your knees behind your toes. You can use the armrests of the chair for balance if you need. What you can do is have a chair set up behind you just for safety and go into a partial squat, keeping your knees behind your toes. This is where the chair can be helpful because if you get too far forward, your knees will bump the chair. This is a helpful reminder to keep your knees back when you squat, which will be much more comfortable for your new joint. Please refer to your guide for how often and how many times you should repeat this exercise. An additional option to help you straighten your knee after surgery is again using gravity to your advantage. If you're able, you can lay on your stomach, typically on a bed, with the edge of the bed ending right above your knee that was just replaced. From here, you can let gravity work to help you straighten this knee over time. Follow the instructions in your guide for how long and often you should hold this stretch. One way to work on straightening your knee after surgery is to use a stool or other sturdy object to prop up your foot. From a seated position, lift your surgery leg up to your stool or available ottoman, and this will leave open space behind your recently replaced knee to allow gravity to help straighten your leg. Please refer to your guide for how long you should hold this stretch and how often it should be repeated. Another way to work on stretching your knee into a straightened position is to have something propped underneath your foot to help provide space underneath your knee, and again, allow gravity to help do the work to straighten this out. Please refer to your guide for how long and often you should hold this stretch. Additional options to work on bending your knee include some in a seated position. To start, if needed, you could use your non-surgical leg, the one without your new knee, to help scoot your other leg back and scoot your heel back as far as you can. Once you get to the point where you feel a good tolerable stretch, hold this position for as long as indicated in your guide, and then you can take a break. Repeat this as many times as indicated in your guide. Another option is to use this same sitting position, scoot your surgical leg, the heel back as far as you can to get a good stretch. If you feel like you can go farther but aren't able to move your heel any closer, you can scoot forward on your seat to get a bit more bend in your knee. Once you reach your tolerable stretch, hold this position as indicated. When you're done stretching, you can scoot back to relieve the pressure. One of the options you can use for your flexion stretches after your knee surgery is using a stair. If you have a stairway at home, please use the bottom stair and a railing for support if available. Take your surgery leg, place it up on the first step to start, and you can use a weight shift by leaning forward to get bend in your knee. Hold that forward position and come back to the start. Refer to your guide for the frequency for how long you're supposed to hold and however many times you should practice this exercise. As your motion improves, you can lift your leg up to the next step for a deeper bend. Another way to practice bending your knee after your knee surgery is very similar to your heel slide exercise. With this, you'll take your surgical leg and try to slide your heel as close to your bottom as you can, getting a good stretch at whatever point you reach. Hold this position and then return back to start. Refer to your guide for how long to hold this stretch position and how many times to repeat this exercise.